So you're considering a VBAC, but the information online is so conflicting and your doctor is confusing you as well. Today, I want to give you some information about having a VBAC, some things to consider so that you can feel confident going into your upcoming hospital birth. Now, first off, let's just define the term. So VBAC is when you've had a successful vaginal delivery after a C-section. But prior to that, you are a TOLAC, which is a trial of labor after cesarean. And yes, the hospital loves these abbreviations. And something you maybe haven't considered in all of this is maybe your feelings. What are you wanting for your upcoming birth? So grab my Birth Plans Made Easy, where we go through lots of different things to think about your upcoming birth beyond just the VBAC, TOLAC, that whole thing. It's great for both you and your partner, and it's really just going to get those wheels turning about what you want this birth to look like. Really quick, I have a whole post on my website about this too. I'm going to put the link down below in case you want more info. Okay, the one thing that I don't hear talked about a lot is the first thing you need to do is discuss it with your provider. And this needs to happen early on in pregnancy. Talk with them if they weren't your provider last time about what your last birth looked like, what you're hoping for with this birth, and then talk through how it all happened, because the history of why you had a C-section really impacts why you might want or need a C-section this time, or if you're a great candidate for a vaginal delivery. If it wasn't the same provider as last time, I think it's actually really important to maybe make some notes before you go into this too, about how things progressed at your birth, what was presenting, what was told to you. You know, if they can get your records from your last birth, that's always a great thing too, or maybe you have your records. But I think really going into detail about that last birth helps give us a really good picture about what you might expect at this upcoming birth. And I want you to remember that it is your provider's job to tell you about the risks that you might be facing based on your choices about VBAC. Remember, they are the expert in the room. Telling you risks and benefits is one of the main parts of their job. So just because they're telling you risks, that doesn't need to be off-putting to you. It's just important that you know that's part of their job. And there are risks to VBACing, but there are risks to being pregnant or having a C-section as well. Now, in that article that I mentioned, I link the American College of Obstetrics and Gynecology's stance on VBACs. They're very pro VBAC, although I still hear that there are hospitals and providers who will not offer a VBAC, which is kind of weird at this point. But I know for some of you, that might be your only provider that you can pick or the only hospital that you can pick. And if that's the case, I don't know what to tell you. You could look at a different city and see if there are other options for you as well. But I know some of you have limited choices. However, if you have choices and your provider saying they will not VBAC you under any circumstances, that's odd. And I would look around for other providers or ask them who they would recommend if you are wanting to do a VBAC. Because I am in the camp that if you desperately want to try a VBAC, even if it seems risky, I think it should still be your choice. I think you get to make the choice in this decision, even if it seems risky. That being said, if you've had a vertical incision or other specific things, it's real risky and you have a pretty decent chance of your uterus coming apart, which is the main concern with a VBAC. For most of you, your scar on your uterus goes this way. And some people, their scar on their uterus goes this way, and that has a higher risk of coming apart as your uterus contracts. So that's something important to know about your previous C-section. It should be in the notes. And as a side note, just because your skin incision goes this way doesn't mean that the inside can't go up and down. Now, when you have that discussion with your provider, I think it's really important to have an honest discussion about your chances of you needing a C-section again. Now, this is going to be based on a lot of different things, very unique to you. I know a lot of people want answers online, but for every situation, it's very different. But your discussion with your provider should include the chance of you needing to have a C-section again. Pro tip, there is a lot of talk about VBAC online just because there's a lot of feelings about having a C-section instead of a vaginal birth. When you're learning about VBAC, make sure that you are learning from someone who has both seen a lot of VBACs and C-section, has helped a lot of different patients manage it. I'm Hillary, I'm the pregnancy nurse. I've been a nurse since 1997. I have 20 years of labor and delivery experience, and I love a good VBAC, but I also love supporting people in making the choices that they want for their upcoming birth. And if that's to have a C-section instead of trying for a VBAC, I'm here to support that as well, because I know that supporting you is often the very best thing that I can do. And beyond that, giving you the truth and the tools to talk with your provider is also a really smart thing. If you're interested in more tools in your toolbox, give me a follow and be sure to like this video so that YouTube knows you love high quality pregnancy content. Now, I want to go through some of the situations just to give you an idea of the chance of it happening again. Okay, the first one is last baby was breech, but this baby looks to be head down. You know, those people are really good candidates for a VBAC because your last baby, for some reason, wanted to be bummed down and this baby is head down. And that's a great option that hopefully a VBAC will work really well for you. Of course, there are risks of your uterus opening up, but they are pretty minimal and I think it would be worth a shot. Of course, in any situation, there are the risks of your uterus opening up, but fun fact, did you know that actually in regular labor, your uterus can still open up as well? So I'm not here to minimize those risks, but I want you to have all of the information. Okay, maybe last time your baby was just kind of malpositioned in the womb. Sometimes they get wedged in a funny spot and it's really hard for them to come down into your birth canal. Now these get triggered because we don't actually have a picture of what's going on in there. All we can really tell is how things look from the outside and what we look at when we're doing an exam. We really can't tell exactly what or why it's going on in there. Again, that just may be your baby. They may have gotten wedged into a funny spot and this baby will come down nicely. So it's hard to know. However, that one, sometimes your pelvis makes your baby come down in a wonky way. And that could happen again with this baby as well. So that's something to know. Really quick, I think it's really important to go over your feelings. If last time was sort of an emergency situation, if you're okay with that type of an emergency situation again, or if you would rather have it more planned and feel more concrete if you're just planning a C-section again. I'm here to support you that if you've had a previous C-section and you're considering just having a C-section again next time, I think that's okay. I think there's a lot of people that villainize that online, but I think there's so many feelings that go into having a baby that if you decide a C-section is best for you, then I'm here for you. I actually have a friend whose first C-section was because baby was breech, and then the second time baby was head down, but she really just felt like she liked her C-section enough and was worried about the risks, and so she just wanted another C-section, and I think that's fine. Every person's different. And we're all bringing our own unique circumstances to the situation. Now, let's say you had some weird illness, like you got a flu last time and you were sick enough that they just needed to get the baby out. Of course, this time circumstances are entirely different. And again, those people are a great candidate to try for a VBAC. Now, sometimes through fetal monitoring, we see that baby is just not tolerating labor. Every time it contracts on it, the heart rate goes down, and that can happen for a variety of reasons, depending on how baby's positioned, sometimes the cord around the neck, sometimes a knot in the cord. And so this one's kind of a tricky one because we don't exactly know why baby was having those issues, but sometimes it's just due to the baby. Sometimes it's due to your body or your pelvis, and we won't know that until we try. So those people can totally give it a try. You just need to know going in, we're not exactly sure why it happened last time, and it may happen again this time. And some people's baby just never descends into the birth canal. And that, again, could be because of the baby, or it could be because of your pelvis. And we won't know until we try. Now, with all of these different situations, you have to think about how much tolerance you're going to have with baby just not looking well or not progressing or things like that. And talk with your provider about how much tolerance they're going to have about that situation as well. Of course, it is ultimately your choice, but some providers are real pushy. If they notice baby is still high, even at a prenatal appointment, they may encourage you to just have a C-section instead of even trying for labor. And again, that's up for you. If you're like, yeah, I thought baby would descend, but it even hasn't already, let's just do a C-section. All of that is up to you. As a reminder here at the Pregnancy Nurse, everything is always your choice. Your provider is just the expert in the room who gives their opinion on things. And now I want to give you the golden rule of VBAC. First off, you cannot make your provider induce you. A lot of people want to have an induction, and some providers absolutely will not induce patients who are trying for a VBAC. Number two, your provider cannot make you have a C-section. And so sometimes you get into this weird standoff of they won't induce you, but you won't let them have a C-section, and you start to get closer to your due date. What do you do? Now, studies have shown that there are ways to induce you that are okay. There are some ways to induce you, like side attack, that are absolutely not okay. And so you'll want to check with your provider to see if anything would be okay with them. But again, there are some providers who just draw a line in the sand saying they will absolutely not induce anyone. As a side note, sometimes I saw the reason that they did that is because a lot of hospitals, if you're inducing a VBAC, that provider needs to be on campus the entire time that we are inducing them, meaning they just have to hang around the hospital. And some providers are not open to that because they can't be doing office hours at the same time. I'm just putting it out there. I'm not saying that's why your provider's doing that, but I will say that I've seen it a time or two. So we talked about the main risk of a VBAC, but what are the benefits? Mostly just not having a C-section. There are risks inherent with having a C-section, which we aren't a fan of. Also, maybe you really want to try and have a vaginal delivery because that's what you pictured in your mind this whole time. So the benefits may vary person to person, but those are the main ones. So what do you need to do if you've decided you want to attempt a TOLAC? I think it's really important to get prepared for this upcoming birth and learn how to incorporate movement into the birth. So many people, when they get in pain, get into like a fetal position, don't want to move, and that's not a great way to make labor progress. So I really recommend learning about some labor movements, encouraging your partner to get in the process of helping you move at the hospital, because I think that can be a really good job for them in the hospital. They can help the nurses move you if you have an epidural, or if you're still mobile, they can help you change position. You can lean on them, all these different kinds of things. Yes, I said getting your partner involved in the VBAC process is going to be awesome. The online prenatal class for couples is a great way to support both of you in getting prepared for your upcoming hospital birth. And I think a lot of people roll their eyes at getting a birth class on their second plus baby, but I am here to tell you that so many people find it really helpful. In fact, I have a basic version that a lot of second time plus moms love to do because it's just the basics and it just refreshes their mind so that they're ready for that upcoming birth. I think you also need to process any trauma that you've had with your last birth. Now, some of that may involve therapy. Some of it may include talking with your provider. I think those appointments can be really therapeutic when you realize what went on and how things are going to change or be different on this pregnancy. That being said, I went to therapy because I was a horrible airplane flyer because my uncle had died in a plane crash when I was in college. And it ultimately really helped give me some tools to manage the anxiety of being on a plane. And I'm a great flyer now. And it didn't take that many sessions. And I'm really glad that I did it. So I would recommend, if you're having a lot of thoughts or feelings about an upcoming delivery, therapy might be a great option. And my last big tip for you is that it is always possible to change your mind. Let's say you go into the hospital, you are gunning for that TOLAC, and you slowly start to realize that the building blocks are there, that you're probably going to have a C-section. And at any point in time, you can pull the plug and say, you know what, I really don't want this to end up like an emergency situation. I think I really just want to do a C-section at this point. Totally be listening to your gut. Now, in all of this, there are going to be a lot of choices in labor and delivery, especially with a VBAC. So make sure that you are learning how to make choices. I have a video all about making the right choices for you that I think you're really going to appreciate. So be sure and check that one out. Thanks for joining me here at The Pregnancy Nurse, where we get you prepared, not scared, for your upcoming hospital birth.